So yeah, this is like very straight going topic, and the topic is extradural hematoma. Extradural, or we can say like epidural, just the same term. Hematoma. Yeah, or we can refer it as hemorrhage, as we are familiar with this term. Okay, something referring to a brain injury. So let's see, as we are mentioning a brain, so let's see the layers from outside to inside, just the basics of it. This thing is the skin, foreskin, where we are having the hairs and all. Yeah, so this is the skin. Below it is a skull. This layer is like the skull. Okay, in this blue layer is dura mater, and then comes the arachnoid matter, that is the green layer. This is the arachnoid matter, and then comes the subarachnoid space between the arachnoid matter and the pia mater. This is space. Okay, the white is this space. Okay, and there then the red line comes, that is the pia mater, and following which there are brain. Okay, this is like brain. Okay, got my picture, what I'm trying to make you understand. So outside the dura, so simple, extradural. Inside the dura is subdural. So as the dura was the blue lining, so we can see inside this blue lining, this is occurs a bleeding clot or hemorrhage. This will be termed as subdural hemorrhage, just to get you a glance of it. Okay, and outside this blue lining and inside this skull, this biconvex presentation is our area of today's discussion, called as extradural hemorrhage, respectively our area of discussion today. Okay, pardon my writing, I'm not great at that. Hopefully I'll be great with you in explaining it. Okay, so there's a term called intracranial hemorrhage, referring to both the injuries of like outside the brain or inside the brain. So what is intracranial hemorrhage? So that can be classified as intraaxial, that is the within the brain parenchyma, or extraaxial, that is outside the brain. Okay, so what do you think extradural hematoma is? Obviously it is like extraaxial, right? Because it is occurring outside the brain. So this is like extraaxial bleed. Okay, or hematoma that is occurring between the dura and the skull bone, as I have mentioned. Okay, so this is our topic of discussion today. Now this type of injuries now have a bimodal presentation. Okay, as I have mentioned here, bimodal distribution or presentation. What do you mean by bimodal presentation is, let me just explain it. Bimodal distribution is either it occurs in the old age, referring to like accidental fall. Patient comes to our IPD, to our emergency, then we shift him depending on the case and severity and the history. Either there is like these type of patients will have a like ipsilateral hemiplegia. Okay, like the same side hemiplegia. This is the feature of it. And maybe